Hello, everyone. Before we get started, do you know how this image relates to Network Health Provider Portal? This represents the collaboration we have with our provider partners on ensuring our portal delivers the best user experience. I'm Jill Stoken, Manager, Provider and Vendor Operations, and I will be providing a high-level overview of our provider portal. The information I will be using is fictional for the purposes of this demonstration. Once you are signed into the provider portal, you will be on Network Health's landing page. We will begin by reviewing the 5 quick links located on the left-hand side of this page. First is the Medicare Benefits at a Glance, which opens in an Excel document. Each Network Health Medicare Advantage plan has a designated tab within the document. Each tab has the same format throughout. Any items highlighted in green are either a cost share or visit limit change from the previous year. If the field is not highlighted, there was no change from the previous year. The next item in the quick links is the provider information form. Providers are able to complete the facility or provider information forms to begin credentialing new providers or facilities. They are also able to complete the provider termination form for any providers that may be leaving their practice. The next quick link is the EDI Claim Rejection Report. Once selected, this will automatically display any claims that may have been rejected for a provider or member mismatch. Just a reminder, Network Health does not reject through the clearinghouse. If a provider has not received payment within 30 days from Network Health, please review the EDI Claim Rejection Report. The next quick link is DSNP Training Attestation. The Model of Care training is required for providers who have delivered care to Medicare Advantage Dual Eligible Special Needs members, DSNP. This training is required annually by the Centers for Medicare and Medicaid Services and is designed to help educate providers on coordinating Medicare and Medicaid benefits for Network Health's DSNP members. The next quick link is the Master Authorization List, which also opens in an Excel document. This document houses all CPT and HCPCS codes that require prior authorization through Network Health. Each Network Health product has a designated tab within the document. You may do a Control-F to search for a specific CPT or HCPCS code to determine if prior authorization is required. If the service requires prior authorization through one of our pharmacy or medical management vendors, the code will not be listed and you will be directed to their website for authorization information. Next, I will review the Eligibility and Benefits tab located on our navigation menu. After you select the Eligibility and Benefits tab, you have the option to search by patient last name, date of birth, member ID, or group number. I will enter a member ID number and select the orange search icon. You are now able to see the additional information of the patient demographics, their specific Network Health plan, and if their plan is active or termed. Whenever there is a blue hyperlink that lets the user know there is additional information on the next page, I'm going to click on the patient name, which brings us to the patient details page. This page provides the patient phone number as well as the primary care physician. We are also able to see what the patient has met to date in their deductible and out-of-pocket, and what they have remaining to meet. On the left-hand side under Plan Details, the most common benefits are listed alphabetically. There is also information for in-network and out-of-network coverage. If the patient does not have out-of-network coverage, it will state not covered. If you see a blue question mark next to the plan benefit name, this provides additional information regarding the patient's coverage. The next tab in the navigation menu is the Claims tab, which has 3 sections. The first section is View Claims. The user may view a specific claim by entering the claim ID and may add additional search criteria such as member ID, status, or date of service. The user may also complete a high-level search specific to claim status or date of service. The results will display all claims based on their registered tax ID and NPI number. I'm going to enter a claim number and select the orange icon. The user also has the option to export this information to Excel or PDF, as well as a print option. You are now able to see the additional information of the patient date of birth, the service dates, as well as the amounts billed and paid. When I click on View Details, I am able to view the service provider, receive date, and an overall summary of how the claim processed. Providers also have the option to view the explanation of payment. The service detail displays how the claim processed per line with the explanation codes. The payment information provides the check number and the check date. The next item in the drop-down is the Claim Dispute/Medicare Record form. Providers must be registered users of Network Health's Provider Portal to submit a provider dispute or a provider appeal. The user will type in the claim number and proceed to Step 2. On Step 2, the rationale for the dispute or appeal is entered along with an attachment. Once the dispute or appeal is submitted, the user will receive an email with the dispute or appeal confirmation number for their records. The last item in the claims drop-down is the EDI Claims Rejection Report. This is also listed as a quick link on the landing page. The next tab on the landing page is the Authorizations tab. All registered users of Network Health's Provider Portal have single sign-on. The user is able to select any Network Health medical or pharmacy management vendor, and they will be directed to their site versus having to enter their username and password. When selecting View Status of Completed Authorizations, the user is able to view all completed authorizations for a specific member. They may search for the authorization by member ID, authorization ID, or service date. I will enter a member ID and select the orange search icon. The user also has the option to export this information to Excel or PDF, as well as a print option. You are now able to see the authorization number, as well as the servicing and requesting provider, effective and end dates, approved visits, procedure, and status. Please note that our medical and pharmacy management vendors have unique authorization numbers. We assign a Network Health authorization number to assist with claims adjudication. The final tab on the navigation menu is the Provider Resources page, which is designed for our provider partners. Some of the feature items on this page are the Provider Reference Guide, which includes phone and fax numbers for some of our operational departments, as well as websites for our medical and pharmacy management vendors. We provide a front and back snapshot of our current year member ID cards. We have a page dedicated to authorization information, which includes information on how to submit inpatient, outpatient, and DME authorizations 24/7 through iExchange. This page also provides authorization information for our medical and pharmacy management vendors. The authorization page also includes our authorization list by code. The Claims Resources page includes our Medicare benefits at a glance, as well as information on provider payment options. Our Medicare Plan Materials page includes the Medicare Advantage Evidence of Coverage, Annual Notice of Change, as well as the dental certificates. The Policies page includes claims payment, medical, and credentialing policies. The Pharmacy page provides the pharmacy prior authorization list, as well as contact information for our pharmacy management vendors. We also have a News and Announcements page featuring updates from our pharmacy, health management, and operations teams to keep our provider partners informed. If you are not a registered user of Network Health's Provider Portal, click Sign Up Now under Provider Portal Access to begin the process. I want to thank you for your time today. Please reach out with any questions, or if you would like a detailed overview of our Provider Portal.